Welcome back. You're still watching Morning Cafe. If you're just joining us, karibu. It's time for first aid measures and tips. This morning we're talking about fractures and bone injuries, something that can happen to anyone, anywhere, and at any time. And Brenda is back to help us with this. Brenda Murugi is a trainer at St. John's Ambulance, and today she's here with her casualty patient, and they'll be doing things here to show us how to deal with fractures and bone injuries. If you're conducting first aid for somebody who has broken a bone or has a fracture, how should you do it? Brenda, karibuni tena sana. Let's just start with a brief introduction. Bone injuries, fractures, what do we mean?
Okay, so by bone injuries or fractures, now usually we define a fracture as either a crack or a breakage of the bone. So if the bone cracks a bit, we call that a fracture. If it breaks completely, we also refer to that as a fracture. But also remember, we have something called a dislocation. Now, a dislocation usually happens at a joint. Okay, so a joint is where two bones are intertwined. Yeah, so you have a joint at the wrist, at the ankle, at the knee. So whenever a bone inatokana in place, that is what we call a dislocation. But a fracture usually happens on a long bone, which is what we've said, it's either a crack or a breakage.
All right, let me just invite our viewers to be part of this conversation. If you have a question for Brenda here, do so. Send it via social media platforms, TV47 Kenya on Facebook and on YouTube. You can tag me as well on X at Ann Odida. Handle on X is TV47 News KE. Now, Brenda, what's the difference between this dislocation and just having a sprain?
Very good. Now, dislocation is whereby, as you said, two bones that were joined, zimetokana. Okay? But for a sprain or a strain is what we refer to as either a tearing or just overstretching, or what we call a ligament. Now, what is a ligament? A ligament is we call it a string. So a ligament is a string and inashikanisha the two bones. So when that string either overstretches or tears completely, we refer to that as a sprain. Now that one is not very serious because with time it will heal. Okay, but now a dislocation is whereby the two bones who are they have zimetokana. So how can you differentiate between a sprain, a strain, and a dislocation? We say for a sprain and a strain, within 2 days, 3 days, the pain usually goes away. Why? Because the ligament has healed itself. Okay, but for a dislocation, the pain does not go away. So if you think you have sprained your ankle, and you can see that within 2 days, 3 days, the pain is still not going away. In fact, it looks like it is getting worse. Then now that you need to go to a hospital so that they can diagnose and see if it is a dislocation. And most of the time, it will be a dislocation. Yes.
So are there injuries that sometimes feel like fractures but are not really fractures?
Yes. A sprain and a strain, most of the time, you usually will feel like a fracture, but it is not. Okay? But if it happens on a long bone, and how will you be able to tell for certain that it is a fracture? Whenever you try and move that part, there is a lot of pain. We say a fracture is very painful. Okay, so anytime you try and move it, there's going to be a lot of pain. At some point, there's going to be swelling. And a bruise. A bruise is what we call a discoloration. Okay, because you find most of the time a fracture is going to be caused by external force. Yeah, so ukigongwa, you can break a bone. So utajuaje, again, as I've said, there's going to be pain and a bruise. Yes.
So how differently do we handle people who have a strain and people who have fractures?
Very good. Now, for a strain or a sprain, we say just apply a cold pack. Okay, so if it is an ankle, for example, we use what we call the RICE. Okay, R-I-C-E. So R.
Simchele. Okay.
Simchele. So R stands for rest. So rest the affected part. So if they were probably using their leg, you can tell them to rest, avoid putting pressure on the leg. And then I stands for ice. So this is why you put a cold compress. You can either use a cold compress, which is found in your first aid kit. If you don't have that, you can use deep freeze, not deep heat.
Okay.
Yeah.
What is the difference?
What is the difference? Now, deep heat, as the name says, it applies heat. Okay, so the heat, usually we use that in a muscle pull. You see, when you have a muscle pull, it is because your muscle has contracted. So we apply the heat to help it expand, reduce the contraction. Okay, but with deep freeze, it is the cold. So which is what we are after. So as strain, we use deep freeze. Okay, and then C stands for comfort. Okay, as well as now putting the cold compress. Okay, and then E is elevate. Yeah, so if you're putting them down on the floor, make sure you elevate the leg.
Show us. We're talking about putting a leg on the floor. Lakini tuone tukiwa nyumbani.
Tukiona tukiwa
So that I
nyumbani.
don't block her.
Okay.
Okay, maybe I should stand here. Okay.
Okay, very good. Yeah, so this is my casualty. She has had a strain or a sprain on the ankle.
Yes.
Okay, so we are saying the first thing we're going to do is to ask her to rest, isn't it? Which she's already resting.
Okay.
And then we are going to apply ice. Okay, so when we apply ice or something cold, we are going to tie, which is now what we are calling compression. Okay, so tying it, I can as well take my bandage,
Okay.
a triangular bandage. Okay, so where I have put the ice, I will come and I will apply a compress. Okay, it can be as simple as that, isn't it? And then we're saying we want to elevate. So elevate means just raise her leg, isn't it? If you have a stool like this one,
Yes.
okay, we can take the stool and then we elevate. Okay, so when we elevate, we are reducing the pressure that is being applied on the ankle. So that is what we mean by rise.
For how long?
For how long? Probably for around an hour. Okay, and then the pain now will have reduced.
Yeah.
But we're saying if you see that the pain is not reducing, then probably we might start thinking about this could be a fracture. Because with a sprain, once we do this, the pain should definitely go away. Yes.
Are there dangers of treating a fracture as a sprain and then, you know, realizing later that you're actually tending to a fracture? Are there dangers that comes with that?
Definitely there are dangers, because you find we say with a fracture, our main aim is immobilization. Immobilization means we want to keep this part from moving, because every time it is moving, definitely the fracture is getting worse. So if we decide to treat a fracture as a sprain, we are saying that if my casualty has been injured today, by tomorrow she'll be walking. So what happens every time she tries to walk? We are making the fracture worse. Okay, and that is why I have said that with a sprain or a strain, the pain will go away after a short time. But with a fracture, the pain is definitely going to be for long.
You're saying you need to leave that, you know, the ice compressed there for like an hour, but ice melts. So do we add more ice every time it melts?
Yes, we need to add more ice every time it melts. Okay, but again, I will always recommend for us to have what we call a cold compress. So the cold compress, it is a gel, okay? So that one does not usually melt, and it retains the cold. So if you can get a first aid kit that has a cold compress, and then we can put it here and it will melt. But for ice, yes, we need to keep on changing it to retain the cold.
Yeah.
Yeah, because that is what we are after.
So do we only experience sprains on the ankle? Kwa knee pia, we can actually experience a sprain there. And how would you tend to that as compared to how you tend to the one on the ankle?
Now, at the knee, at the ankle, it is the same. As long as we're saying that there is overstretching or tearing of the ligaments. So you have said that ligaments are at every joint. So at the ankle, we have ligaments. At the knee, we have ligaments. At the wrist, at the elbow, we also have ligaments. Okay? So anytime talking about a sprain, it is the same thing. Now, for the upper part, what we call the upper limbs. The upper limbs are from the waist going up. We usually have a different way of elevating. Yeah, but for the knee, for the ankle, it's going to be the same thing. We still need to elevate.
Yeah. So how do we do it for the upper limbs? Like you mentioned.
Very good. I'll ask my casualty to stand.
So this one you're still working with the strain?
Yes.
On the upper limb?
On the upper limbs.
Okay.
Okay. So again, probably my casualty has strained the wrist or the elbow. Okay. So if it is at the wrist, we are going to do what we call an elevation sling. So an elevation sling is whereby we need to support the hand at a 45-degree angle. We call it a 45-degree angle. Okay. So how do we do it? Now, I will use my triangular bandage. Okay, so it is called a triangular bandage because, as you can see, my bandage is in the shape of a triangle. Okay, now when I hold it like this, it is upside down, isn't it? So I will take this part and bring it up. Okay, now this part that I'm holding is what we call the apex. So the apex goes to the elbow. Okay, and then the other part that I'm holding goes there above the arm. Okay, and then now this part that is hanging, I will tuck it under the injured arm. So this is the injured arm, isn't it? And then I will tie it at the back. And then when we tie this at the back, your casualty will still be able to move their arm, which is what we are avoiding. Okay, so this part here, okay, where our apex went, we are going to twist it, okay, twist it, and turn it. So this is what we refer to as the Moses basket. Okay, so we are going to twist it here, tuck it in, and then my casualty's arm is immobilized. Okay, now since we had a cold pack, where will I put my cold pack? I will put my cold pack where?
Where the injury is.
Where the injury is. Okay, so I'm going to tell my casualty or advise my casualty to leave their arm in this position with the cold pack until the pain eases. Yes.
All right, so we don't just take that ice from the freezer and just insert it there. It has to be inside something?
Yes, so what you usually say, remember ice on its own can cause a burn, what we call a cold burn. Okay, so what we do, kama ni ile nyama ulikuwa umefreeze kwa freezer ama zile minji, wrap it in a bag, in a nylon bag, or wrap it in a piece of cloth. And then once you wrap it in a piece of cloth, you come and you insert it there. Yes.
All right. What options are there for people who, you know, don't have this triangle kitamba?
Kitamba. So unaweza chukua kama ni leso uko nayo, make sure the leso is in a triangular form, and then you can tie it. If you don't have that, it is as simple as, if you'll allow me, I will untie this.
Okay.
So remember, we defined first aid as using available materials, isn't it?
Yes.
Or using what you have. Now, if this is my casualty's arm, it is as simple as, if she's wearing a jacket, I put it here and I make sure that her jacket is zipped to the end.
Yes.
So that way her arm is going to be supported in an elevated manner. Yes.
How about, you see wale watu wa ushago, they have to put some sticks on the hand. What is the significance of that, and does it work? Now, the sticks do work. So they had an idea, isn't it? Because we say for a fracture, we need to immobilize. We need to keep the part from moving. And I usually give an example. Now that is a fracture, not a sprain.
A sprain.
Okay.
Now, so we say, for the sticks, we won't really use it in a sprain or a strain, because a sprain or a strain, we don't need to keep on keeping it from moving. That one will go for a fracture. Okay, so if kama ni uko ushago, they just need to elevate it and then put something cold. But now when we get to a fracture, is whereby we say tunaeka vijiti mbili hapa, tunafungilia, so that we can keep this arm from moving. Because remember, we say with a fracture, we need to immobilize to keep it from moving. Yes.
Now, even as we get into that topic on fractures, what are the most common causes of fractures?
Now, the most common causes of fractures usually will be either a fall. Okay, so when someone falls, their bone breaks, or external force. Okay, so something has hit you to a point where your bone has either cracked or completely broken. So most of the time it will be things like road traffic accidents. People usually get a lot of fractures, falling from a height, you are kwa ladder, umeanguka chini. If it is a child, they were playing on the stairs and then they fell all the way down, so they are going to get a fractures. And remember, fractures are usually common in small children and elderly. Yeah, because their bones tend to break. Yes.
And you know, I was coming to that point of the age and the age factor, because one time I was interacting with someone and they said that the older people are easily susceptible or are susceptible, of course, to fractures. Then why, unajua mtu atanguka tu kidogo hivi, anasema ankle imepasuka, knee imepasuka katikati. Why is it so easier for them? And for children, I understand it's easier for them to heal faster, but why is it hard for the elderly to heal faster? To heal faster.
Now, for children, it is easier for them to heal very fast because we say as their bones are developing, remember when they are born, their bones are usually more of cartilage. So cartilage it bends very easily, so even the healing is very easy. But for the elderly, it is very easy for them to break because remember, as you age, your calcium inaendanga iki reduce. Yeah. So for an elderly person, when they fall, it is very easy for them to break the bone. It's a condition known as osteoporosis. Yes.
I was looking at, you know, we have different types of fractures. Maybe if you can explain it to us. We have green stick, comminuted, is it how it's called? And the compound, in simple terms, of course, for the benefit of our viewer and for me as well. How would you explain it?
Now, green stick fracture is usually just a crack. Okay, so this one is very common in, again, the young people and the elderly. The children and the elderly, they get a lot of green stick fracture. Why? Because their calcium is not a lot. So anytime the bone gets any type of force, it just cracks. Okay. Now, compound fracture is whereby the bone has broken so severely to a point where there are small bits. Okay, so there are small bits of the bone. And then now for the comminuted fracture, it is whereby there is a crack on the bone, but the bone has not detached. Okay, so if ni hapa imevunjika, there's going to be a crack, lakini mfupa haija, it's not out of place. Yes.
Which ones are most common, say with road accidents, for instance? And do we experience more fractures with road accidents or falls?
Most of the time it is road accident because a fall, unless it is a severe fall from a height, most of the time it's not going to lead to a fracture because remember, your bone is hard. Okay, so it takes a lot of force for you to break this bone. So most of the time it is going to be a road traffic accident. But again, I repeat, in children, the young ones and the elderly, wale wazee, even a small fall can lead to a fracture. Yeah, it might seem exaggerated, but again, we have said that they do not have a lot of calcium deposit in their bones, meaning their bones are very brittle. So hata ile kuanguka ile kidogo, enye wewe kama mtu mzima, you will fall and you will wake up and walk. For them, it is very tricky. Yeah, so we can say that children and the elderly ones, mostly it will be falls. But for us, wale tuko hapo katikati, most of the time it is either a road traffic accident or falling from a height.
All right. So you've shown us how to handle a fracture on the arm. Show us how to handle one on the ankle and then on the knee as well.
On the knee as well. Okay. Now, before we go down there, I have showed you one type of sling, which is what we call an elevation sling.
Okay.
Now, there's another one that is called an arm sling. Okay. So an arm sling is whereby my casualty's arm is going to be at a 90-degree angle. Okay, so for the elevation sling, this one that we have done, where do we normally use it? When the casualty has injured either the wrist or the fingers. Just that. Okay, the wrist and the fingers, we use an elevation. For the arm sling is whereby the casualty's arm is like that. So again, I am going to use my triangular bandage, and then I will slide it under the arm. Just like that. Okay, so I know my casualty is going to be in pain, but remember, I keep on reassuring my casualty. And then I will tie this at the back. Okay, and then I will come back and do my Moses basket, just like that.
Why is it called a Moses basket?
It's just a name that we coined as we went along.
Okay.
Yes. Okay. So this is the arm sling, and where do we use the arm sling? When the casualty has injured either the collarbone, okay, the breastbone, the ribs, or any part that is from the wrist going upwards. Remember, from the wrist going lower, we have used the elevation. So from the wrist going upwards, we are going to use the arm sling. So anytime your casualty has broken a bone from the waist going upwards, ask yourself, where is the fracture? Okay, so if it is from the wrist kwenda mbele, we're going to use the elevation. From the wrist kurudi nyuma, we use the arm sling. Okay, so can I do it from the waist?
Before we go from the waist, what will cause a collarbone fracture?
Most of the time it is a road accident. Yes, so anytime a casualty is in a road accident, especially if they're the driver. Remember, because of that force, okay, the force can go all the way from your hands when you're holding the steering wheel all the way to the collarbone. So that one can cause a breakage. Again, falling from a height. Yeah, so you're on the 3rd floor, 4th floor, you fell down. This one is definitely going to break. Yes.
All right. From the where down?
Now from the waist going.
From the waist down.
From the waist going downwards.
This one we assume now they have fallen down. Because now, can you be injured and still standing?
No, you cannot.
Okay.
No, you cannot. So my casualty. Okay, very good. So my casualty, I found them on the ground.
Yes.
Okay. So again, we refer to the example ile ya mbuzi. Mbuzi ikivunjika tulikuwa tunaambiwa tunaweka miti, si ndio? Unaweka miti ndio we immobilize. So because it is usually hard kupata mti that you can use, usually we say use the uninjured leg as our immobilization. Okay, so if my casualty, let's assume our fracture is here, where I have put the paper, isn't it? Okay, so we are going to put 3 bandages. We say above the fracture, below the fracture, figure of 8.
Okay.
Okay. So I will need to use 3 bandages. If you don't have a bandage, you can use whatever you have. Okay, you can use a lasso, you can use a piece of cloth that you have tied.
A belt.
A belt, very good, okay. So this is the second one that we are going to use.
Does it have to be tight?
No. Okay, so it has to be tight to reduce the movement, but not too tight that you impede circulation. Yeah, remember we still want to keep the blood flowing. Okay. So this is it. Now, I am going to use what we call body hollows. Now, body hollows ni zile zenye ukilala chini, they do not touch the ground. Okay, so where do we have our body hollows? We have one at the ankle. Okay, we have at the knee. We have at the waist. Okay, and we have at the neck. Why? Because I do not want to keep on moving my casualties' legs. Remember, they are broken.
Yes.
Okay.
They're called body hollows.
Body hollows.
We learn something new every day.
Good. Now, so we are saying that if my casualty has broken this leg, I am trying to use this uninjured leg as the immobilization support. Okay. So nakuja nazishikanisha.
Okay.
Now, when you are at a rested position, okay, your legs usually form a V. So that is how you were created. Ndio ukitembea usiende ukijitenga. Yeah. So we are going to put one bandage, okay, at the ankle. And this is what we are going to do. We are going to hold the bandage at either end, bring it across, kaza, and then we bring it at the back. Okay. So when I tie this, now this is what we call the figure of 8. You can see it is forming something that looks like a number 8,
yes.
isn't it?
Figure of 8.
Figure of 8.
Okay.
Okay. And then I'm going to insert one bandage at the knees. slide it down, okay, insert another bandage at the knees and still slide it down, okay, and then I am going to tie these bandages, and as you can see, I am putting my knots on the uninjured leg.
Yes.
Okay. And then
Why do we put that on an injured leg? Is it to prevent more pain?
Yes, we are trying to prevent more pain. Okay, so we say the knots go on the uninjured leg. So if they've broken the left leg, we put it on the right leg. If they've broken both legs, the knots are going to be at the center.
Okay.
There. Okay, so what have I done? I have tied a bandage above the fracture, below the fracture, figure of 8. Okay, so even if the fracture was here, again, I'd have done above the fracture, below the fracture, and figure of 8.
Yes.
And then if we are to transport our casualty at for a long distance, we're going to put what we call padding. Okay, and where do we put padding? We put padding in 3 places. Number 1, at the ankle. Number 2, at the knees. Number 3, at the groin. Whereby we want to prevent the friction as we are moving our casualty. Yes.
Can one attempt to move the limb?
It will be very painful.
For them?
For the casualty, yes.
Hakuna dawa unapea mtu painkiller?
Hapana. As a first aider, you're not allowed to give any medication. Yeah. The only person who is allowed to give any medication is someone who has been licensed by the Poisons and Pharmacy Board. Yes.
Now say they have broken the knee, a joint here, right here, the knee. This one we are working with the ankle. So how would we do it for the knee? I know that you've said if we were working with the upper part, we would still put them on the body hordos, but how about the knee? And I'm asking this because I have interest in that, the knee specifically. I have a patient with a broken knee.
And very good. Now, remember, if a casualty has broken the knee, any time that the knee is touching the ground, it is applying pressure. Okay, so what we want to do is to relieve that pressure. So how do we relieve the pressure? We just elevate the knees like that. So put something here like a blanket, okay, or a piece of cloth that will enable us to elevate the knee, and then the figure of 8 still remains because we want to immobilize. And then if you're moving them over a distance, again, we're going to put a padding at the knee to reduce the friction, and at the groin and here. Yes. Okay, so if it is at the knee, I will remove this. Okay, so let's assume this is my blanket. I'm going to put a padding under the blanket to make sure that the knees are elevated to reduce the pressure. Okay, and then the figure of 8 still remains.
Considering with a broken knee, one cannot bend it. So how do you ensure that, you know, even as it's raised like that, not much pressure goes on to, you know, that particular knee, and alternatively the leg as well?
Now, as we are trying to move it or to elevate it, there's going to be pain. Okay, tukubaliane. Ndio. But we are just telling them, avumilia tu kidogo so that we elevate. Because ikiwa in this position, definitely the pain is going to reduce. But if we leave it like that on the ground, they're going to be in much more pain. So unamwambia, just relax, vumilia kidogo, we want to elevate the knee, and then once we elevate, that's it. Yes.
Would it need to be more painful? Say, wafike pale hospitali, and then the doctors now are removing those things for another set of, you know, treatment and first aid. So why don't we just do something that is once and for all?
Because we are first aiders. Yeah. All we can do is to get our casualty to hospital so that they can help the patient. Okay, and there's something I like to say. Remember, anytime you're giving first aid, there's going to be pain. Anytime you're trying to move that part, there's going to be pain. So we need to work with that. There's going to be pain, and that is why we say, as a first aider, you need to keep on reassuring your casualty and explaining to them what you're trying to do. Because tukimwacha venye yuko, again, situation is bad, isn't it? We need to relieve the situation. And part of relieving the situation is there's going to be pain. Yes.
So are there chances where a fractured knee would not need a chuma? in it.
Yes. Now, for the knee, usually we refer to it as a dislocation, whereby you find the kneecap
Yes.
ilisonga. So for that one, they're just going to return the kneecap in its original position, okay? And then probably we are going to put a band, what you usually see the casualties wearing. And then you're going to be told for some time, do not walk on your knee. So there are chances, yes, whereby it might not need a chuma. But if the knee is broken to a point now where we refer to it as a compound fracture, remember the compound fracture, whereby the bone is broken and it is disintegrated. Now for that one, they might need to put a chuma. Okay, lakini if it is just the kneecap that has moved, then we can return it to its original position. We put a band, okay, and then advise your casualty or advise the patient not to move on the knee for some point until the knee heals. Yes.
So what's the role of therapy after all this?
What is the role of therapy? Because you need to be able to learn again how to walk. Okay, so if I can put it in a layman's language, whenever you are not using any part of your body for some time, the body forgets. Okay, so you need to relearn how to use that part of the body. So if you had a broken leg, okay, remember for a very long time you're going to be out of your leg. So for you to remember how to use your leg again, we need to take you through down the physiotherapy.
So how do we handle the femur in terms of, you know, a dislocation or a fracture? Because I hear it's the leg, it's the bone holding us. But now how do we handle that dislocation?
Okay. Now, the femur is the bone that is the thigh bone, what we call the thigh bone. Okay. So as you said, it is the bone that supports us, that usually helps us to walk. Okay. So the same way we have done here at the tibia, we are going to do it at the femur. So if a casualty has broken the femur, we are going to tie a bandage above the fracture, below the fracture, and the figure of 8. Okay. If we have what we call an open fracture. Now, what is an open fracture? An open fracture is whereby the bone has broken to a point whereby you can see the bone protruding through the skin. Now that is the worst kind of fracture you can get. Cindy? So if you find that a bone has protruded through the skin, we are just going to very quickly use a dressing. Okay. Very slowly, we are going to tie the dressing over the bone, not very tightly, because again, we don't want to return the bone inside. We just want to protect it as we're taking our casualty to hospital. Okay, so using my body hollows.
The one at the knee?
The one at the knee, very good. Now we'll take it round and then put it over the broken bone, isn't it? Okay, and then now we are going to tie above the fracture, below the fracture, and the figure of 8. Yes.
So how do we prioritize stopping bleeding and also immobilization at the same time?
Now, always go with the bleeding first. Okay. Whenever you're giving first aid, we usually say, check your priorities. So what is our priority? What will kill you faster? Is it bleeding or is it a broken bone? It will always be bleeding. Okay. So first of all, start with tying the bandage on top of the bleeding. Okay. And then once you're sure that the bleeding has stopped, then now we can do above the fracture, below the fracture, and the figure of 8. But we're saying prioritize the bleeding. Yes.
So when should we stop now moving an injured casualty or patient, you know, in terms of, say, an accident? When should we not move them from that position?
We say, always try as much as you can not to move your casualty. Okay, only move them if it is necessary. And when is it necessary? Number 1, if you're loading them onto an ambulance to take them to hospital, or number 2, you can see that where your casualty is, they're in danger. Okay, so for example, in a road traffic accident, remember we say with a road traffic accident, the first thing you need to do is to put the warning triangles. So when you put the warning triangles, you are alerting other drivers that there's an accident, okay, meaning that they are going to watasonga kando, isn't it? So if the road traffic, the drivers are moving aside, meaning we don't really need to move our casualty. And that is a very bad habit that we have as Kenyans. Yeah? Anytime there's an accident, we want to shika kichwa, mimi nishike mguu, tufanye nini? Tumsongeshe, si ndio?
Yes.
Do not move the casualty unless it is completely necessary. Yes.
So what's the correct way to move them if it's necessary?
Now, if you need to move them, okay, now number one, look at how many bystanders you have. So your bystanders are going to help you to carry the casualty. And even as we are carrying them, we need to use a stretcher or a blanket. So we need to put a blanket under our casualty, we carry our casualty, and then we move them at the side. If your casualty can walk, okay, it is okay. But remember, we are saying, try as much as you can not to move the bone and not to move the casualty. Yeah? So especially if it is in form of a fracture, the best thing we can do is we try and get a blanket, a leso, a shuka, and we slide it under the casualty, and then using your bystanders that are there, we move them to the side of the road. Okay, a stretcher, most of the time it will come with an ambulance, which is why I'm insisting, can we wait for the ambulance to arrive so that we can move our casualty. Yes.
How about those casualties that are, say, unconscious? Say, ameanguka kutoka huko juu, ako unconscious, or the shock that comes with an accident, they're unconscious. How do you know where the dislocation or the fracture is so that you can tend to that particular area?
Now, when we say a casualty is unconscious, it means that if I try and call out their name, they cannot respond. If I give them a command, for example, I say, open your eyes, blink, isn't it? Squeeze my fingers, my casualty cannot respond. But this casualty is going to respond to pain. Okay, so we do a very quick survey that we call top to toe survey. So top to toe survey means we are going to touch our casualty from the head all the way to the toes, try to find where there's a dislocation or a fracture. Remember, we have said a fracture is very painful. So even if this casualty is unconscious, kuna mali utaguza and you're going to see a reaction on their face. Okay, so if they're unconscious and they have fallen all the way from up, we are going to do the top to toe, which is whereby we are going to touch our casualty, okay, as we go, isn't it?
And in this case, they're unconscious?
They're unconscious,
okay,
isn't it? Okay, so we are going to do this. So as I'm doing this, what am I trying to see? I'm trying to see where exactly I will touch and my casualty is going to respond. So if I touch here and then I see a reaction on their face, I will definitely know that this is where they have a broken bone. Okay, so I'm going to deal with the fracture. Okay, as you said, above the fracture, below the fracture, figure of 8, and then now I wait for an ambulance so that now we can transport my casualty.
So what complications could arise from, say, a poorly treated fracture?
Most of the time, if you don't treat a fracture very properly, number one, remember it can cause internal bleeding, okay? Or number two, problem with nerve damage, yeah? So remember, nerves are usually intertwined with our bones. So anytime you have a broken bone and you don't deal with it properly, it can lead to a problem with the nerves. So even in future, even if the fracture heals on itself, because fractures do heal on themselves, okay, but you're still going to have a problem with the nerves. That's why you find anytime it is cold, someone is going to be complaining of pain. Pale kwenye alivunjika. Yes.
So sometimes I've heard of this. Hapo kwa knee, somebody amewekewa chuma and then that chuma is removed and then they're not able to bend that knee even after healing. What causes that?
So again, remember we have said that anytime you take some time without using any part of your body, there's going to be pain. Okay, so if they try and bend it, there's going to be pain. And remember, even after amewekewa chuma, tulisema ukiona mtu amewekewa chuma, especially at the knee, it means that the kneecap was probably damaged, very damaged. So even if atolewe hiyo chuma, the kneecap will probably not go back to the way it was. So anytime they try and bend, there's going to be a lot of pain. And I think that's what we need to know with fractures. If you have broken a bone, even in future, you're going to find a problem using that part of your body. Yes.
Does that come along without, say, lack of physiotherapy after maybe healing or say in the healing journey?
No. Yes. So even with physiotherapy, they're still going to be feeling some bit of pain. Yes.
What are some of the mistakes now as we wind up that you see we do or people do when conducting first aid on people who have bone injuries and fractures?
The number one mistake is that we keep on moving them. Okay, we want to try and keep on moving them. Unamwambia simama tutembe, and you can clearly see that this casualty has a broken leg. So remember, the more you move a fracture, the worse it gets. It could be that you only had a crack in the bone, but because we keep on moving you, now we have graduated from a crack, okay, to a compound fracture, whereby it gets worse. So I think that is the number one mistake that we make. We try and keep on moving our casualty, and that is why, again, I repeat, do not move the casualty unless it is completely necessary. Just leave them in the position that you found them.
Which bone area or injury would you say it's the most very critical for one to have? Is it the femur? Is it the knee? Is it the ankle? Is it the collarbone? Which one is most dangerous?
The most dangerous, this one, what we call the pelvic bone.
Okay.
Because remember, anytime a casualty has broken the pelvic bone or the waist bone, most of the time they're also going to have an injury on the spine. Okay, because the pelvic bone and spinal injury huwa zinaendanisha. So the one that we're usually most worried about is this one, the pelvic bone. Yes.
So you know, sometimes we talk about first aid training. For bone injuries and fractures, at what age do you now give out this training to people? Because last week we were talking about another topic and they said just from as young as, say, 5 years. But for fractures and bone injuries, which age is recommended?
Again, as young as they can. Okay. We say it is better to train someone when they are very young because it is easier for them to retain the information. So even for a bone injury, if you can train the children from as young as they can how to deal with a bone injury. Remember, we have said children are the most, they are at risk of breaking their bones, isn't it? So if you have a child, make sure that they are trained from as early as they can so that even if they see their friend on the playground, they can be able to, number one, identify, is this a fracture, okay? Is this a sprain or a strain? And then train them on how to deal with the injury. Yes.
We have a caller. Elizabeth is calling from Naivasha. Good morning, Elizabeth. I'm sure that is for you. Elizabeth, good morning.
Good morning to you.
Yes, talk to us.
Keenly following the program, and I have a question. My daughter is 13 years old, and lately she has been complaining about her back break. Do I call it a back break on her left hand side? The back break that on her back. I don't know how to describe that part. When you move your hand, there is this part of the protrudes on the back. So any frequently she has been complaining pain behind on that back break. And I took her one time to the doctor. She said maybe she had carried something heavy which she had not. But over and over, frequently she has complained about that pain. It goes away after some time. Then after like 2 weeks, she tells me she's feeling that kind of pain. Then it disappears like that. And it's a concern because there was a time she was not able to, she was given a punishment, I think, to carry a bucket. And when she carried it, I bet it excavated. But it's a pain that it's only from time to time. On the back of the right side, the back plate. I don't know what to call it. Yeah.
All right. Thank you so much, Elizabeth, for that. We did get her clearly, but she's talking about, I think, her daughter's hand is quite painful on the back when she tries to move it. So what would be the cause of that?
Okay. Again, remember we have said that most of the time our nerves are intertwined with our bones. Okay. So if your bone moves even a very small distance, it is going to affect the nerves. So if she's saying that it is a long-term pain, probably she needs to take her child to hospital, get a CT scan done, and then see if the nerves are in order. Because if it was a fracture, then definitely that child will not be able to move. But we're saying if it is a long-term injury, okay, that's why we're saying that the nerves inaweza kuwa, I think she said something about carrying something heavy. Yeah. So that carrying something heavy could have probably affected the bone structure. So if you affect the bone structure, definitely you're going to interfere with the nerves. Yeah. So I'd advise aende hospitali, get her checked and see if the nerves are in order. That could be the problem, which is causing the pain.
In regards to first aid on bone injuries and fractures, what would your parting shot be? What would you love for people watching us to know about this, to learn and unlearn?
Very good. Now, with a fracture, the easiest way you can identify a fracture is if you touch it, it's going to be very painful. If the casualty tries to move their limb, it's going to be very painful. So how can we deal with that? Try and immobilize. Keep your casualty from moving. Okay, so as we have said, if it is from the waist going up, you need to decide, am I doing an elevation sling? If it is from the wrist kwenda juu, or am I doing an arm sling? From the wrist kurudi nyuma.
You can now stand.
Thank you. Okay, so we are saying from the waist kwenda juu, either you do an elevation or an arm sling. If it is from the waist going downwards, just do above the fracture, below the fracture, figure of 8, and do not move the casualty. Yes.
All right, thank you so much, Brenda, for making time once again to teach us 1, 2, 3 on how to handle bone injuries and of course fractures as well. That's it. This is the Morning Cafe. That brings us to the end of the show. My name is Anne Odida. Good morning.